If you have high blood pressure, the medication you are taking matters way more than you think. And today, I will show you why. You see, high blood pressure continues to affect hundreds of millions of people around the world. And here's the deal. When it comes to treatments, there is a long list of medications out there. That leaves many people wondering, why this one and not the other? So in this video, I'm going to answer a question that comes up all the time. If you've been prescribed one of the two most common high blood pressure medications, Amlodipine or Hydrochlorothiazide, which one is better for you? Well, maybe you have just been diagnosed, or maybe you are already taking one and wondering if it's really the best fit. Either way, you are in the right place, because by the end of this video, you will have a clear, simple understanding of how these medications work, what side effects to watch for, and how to have a smart, informed conversation with your doctor about your treatment options. Welcome back to the channel. And if it's your first time here, don't forget to hit that like button and subscribe to the channel. Now, before we get started, first, let's talk quickly about why controlling blood pressure is so important. You see, high blood pressure, or hypertension, is often called the silent killer because it can cause serious health problems like heart attacks, strokes, kidney failure, and more. And many people don't even realize they have it until it's already causing damage. So managing it early and effectively is absolutely critical. And thankfully, we have proven ways to manage it, like regular exercise, eating nutritious whole foods, and when needed, taking the right medication. But not all blood pressure medications work the same way. And that brings us to two of the most commonly prescribed options, Amlodipine and Hydrochlorothiazide. So what exactly are these medications? Well, let's start with Amlodipine. Amlodipine is what's known as a calcium channel blocker. I know that sounds very technical, but basically, it works by helping your blood vessels relax and open up, which makes it easier for your heart to pump blood through your body. Think of your blood vessels like small, flexible tubes. Normally, calcium helps the muscles in those vessel walls contract, which can make the tubes narrower. Amlodipine blocks some of that calcium from entering the muscle cells, keeping the vessel walls relaxed and open. That means blood can flow more freely, making it easier on your heart and helping to lower your blood pressure. It's an incredibly effective medication not just for hypertension, but also for angina. That's chest pain some people feel when their heart is not getting enough oxygen. On top of that, it even helps reduce the risk of certain types of strokes. One of the big advantages of Amlodipine is how simple it is to use. It's usually taken just once a day, which makes sticking to your treatment plan much easier. But like every medication, it is not perfect. Some people experience side effects like swelling in the legs or ankles, flushing, or feeling dizzy. Most of the time, these side effects are mild, but for some people, they can be annoying enough that they want to switch medications. Now, let's switch gears and talk about hydrochlorothiazide, often just called HCTZ. This medication has been used for decades and belongs to a different class altogether. It's a thiazide diuretic. You might hear it called a water pill, and that's exactly what it does. It helps your body get rid of excess salt and water through your urine. Less fluid in your blood vessels means lower pressure. Here's an easy way to think about it. Imagine your blood vessels are like garden hoses. When there's less water flowing through them, there's less pressure on the walls. That's essentially how HCTZ helps lower your blood pressure. Typically, it is also taken once a day in most cases, which makes it pretty convenient. However, it's not without its side effects either. Because it causes you to lose water and salt, it can sometimes lead to dehydration or low levels of important minerals like potassium. Some people also experience increased urination. No surprise there since it's a diuretic, especially when they first start taking it. So you may find yourself making a few extra trips to the bathroom. That's why it is recommended to take it in the morning to prevent waking up in the middle of the night to use the bathroom. Other possible side effects include dizziness, may slightly increase your blood sugar, muscle cramps, and even sexual problems. Very rarely, it can trigger more serious issues like gout attacks or significant electrolyte imbalances. And while these side effects sound a little scary, remember, most people tolerate this medication really well, and side effects can often be managed by adjusting the dose or adding a supplement such as a potassium supplement. So who should consider which medication? Well, your overall health profile is a really important factor. For example, if you have a history of heart failure, hydrochlorothiazide might be helpful because it can reduce fluid overload. If you have angina or chest pain from heart disease, Amlodipine might be better because it helps blood flow more freely to the heart muscle. Race and ethnicity can sometimes influence medication choice too. Some studies have shown that amlodipine and similar drugs might be especially effective in African American patients when compared to other types of blood pressure medications. Now, with all of that in mind, you may be wondering, which one is better for me? Well, the truth is, there is no universal answer. And honestly, that's a good thing. Your doctor considers your whole health picture, not just your blood pressure readings, when deciding which medication to start you on. Things like your kidney function, your risk for heart disease, your lifestyle, and even how sensitive you are to certain side effects all play a role. And here's a little secret. Sometimes it's not even an either-or situation. Some people take both amlodipine and hydrochlorothiazide together because they work in different ways and can complement each other nicely. Okay, so what does all of this mean for you? Well, let's address a few frequently asked questions because I receive these all the time, and chances are you have probably asked one of these yourself. First, can I switch from one to the other? The answer is yes. If you are experiencing side effects or not achieving adequate blood pressure control, your doctor may suggest switching from amlodipine to HCTZ, or the other way around. Next, can you take both together? As I just mentioned, yes, sometimes that's exactly what's needed to get your blood pressure under control. And finally, is there anything I can do besides taking medications? Absolutely, 100%. Lifestyle changes can be incredibly powerful. Things like eating a healthy, whole food diet, avoiding ultra-processed foods, exercising regularly, losing even a little weight, and managing stress can significantly help lower your blood pressure. In fact, sometimes these changes are so effective that you may be able to reduce your medication dose or need fewer meds altogether. You see, that's the kind of control you can have over your health. And honestly, that's pretty empowering. So to wrap everything up, both amlodipine and hydrochlorothiazide are excellent tools in our toolkit for managing high blood pressure. And millions of people take them every day, not just to lower their numbers, but to actively reduce their risk of serious conditions like heart attacks, strokes, and kidney disease. Now, even though both medications are effective, they work in different ways, have different side effects, and may fit different people better depending on their unique needs. The most important thing you can do is stay informed, track how you feel, and have open conversations with your healthcare provider. Because managing your health is not something you want to leave on autopilot. Taking an active role in your healthcare can make all the difference. And there you have it. Remember, knowledge is power, and you have the power to make informed choices for your health. Thank you for watching.